Welcome, everyone, to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Palliative care. You know, we've heard about it before, but it's so good that we really want to hear more about it. It's specialized medical care that focuses on providing patients relief from pain and other symptoms of a serious medical illness. Now, who's a candidate? Who could benefit? What services does a palliative care team provide? What services does a palliative care team provide?
And what's the difference between palliative care and hospice care? Joining us by telephone from the Mayo Clinic in Florida to explain is palliative care specialist Dr. Maisha Robinson. Welcome to the program.
Thank you for having me.
Thanks, Dr. Robinson, for joining us. Now, she is not only a palliative care specialist, she's also a neurologist. Actually did her residency in neurology right here at the Mayo Clinic. So, but how do you like it in Jacksonville?
Well, thank you so much for having me. I'm enjoying my time in Jacksonville. I split my time between neurology and palliative medicine, and I also have a neuro-palliative care clinic here. So I'm thoroughly enjoying the work that I'm doing.
Neuropalliative care, meaning that patients with brain issues, strokes, etc., you provide palliative care for them?
That's exactly correct.
So
Not only strokes and brain conditions, but also people that have, for instance, dementia, multiple sclerosis, ALS, almost any neurologic condition can benefit.
And unfortunately, there are a fair number of those.
I think
Yes,
we're
sir.
still at a point where palliative care and hospice care are confused, so set everyone straight.
Yes, I think a lot of people, when they hear palliative care, they automatically think we're talking about hospice care. What I usually say to people is that palliative care is a focus on trying to improve quality of life for people that have serious or advanced medical conditions. And that's really an umbrella term. Many people with advanced conditions, chronic conditions, can benefit from palliative care. And it's appropriate, we say, at any age and at any stage. Hospice care is palliative care, but specifically for people who are closer to the end of life. Usually, when people have a prognosis of 6 months or less, if the disease progresses in its normal fashion, they are eligible for hospice care. So all hospice care is palliative care, but not all palliative care is hospice care.
And part of the difference is if you're in palliative care, you don't have to stop treatment for your underlying condition. But generally, when you go to hospice care, medical treatment stops. Is that correct?
That's essentially correct. Usually when people are in palliative care, it can be concurrent with their, for instance, chemotherapy or the treatments that they're getting for lung disease or heart disease or with dialysis. In general, when people transition to hospice care, they're really focusing on comfort, quality of life, and not necessarily life-prolonging care. Now, specific discussions would be had with the hospice team about what medications and interventions would continue and which ones would not.
So if you are a candidate for palliative care, how do you get hooked up with the team? Do you have to be in the hospital to see a palliative care specialist?
So let me say, almost all providers are providing some degree of palliative care. We call that primary palliative care. Your primary care doctor, your neurologist, your cardiologist, everybody is trying to help people live better with a better quality of life. But then there are specialist palliative care physicians and teams. For instance, that's what I do, and we can be referred to by people's primary care doctors or other specialists, the same way that they can refer you to a cardiologist or a pulmonologist or a neurologist.
What's the most common reason? I mean, why would a family practice physician say, I think we need to get the palliative care team involved? Why would that be?
Many times if people are having difficulty with complex symptoms or if there are some issues between the patient and family members, or if there's a question about what's the next best step or what are the goals of care, people may say it's good to sit down with a specialist in palliative care to really talk through some of these issues or to make recommendations for treatments or management moving forward.
Is it covered by insurance?
It is. It's actually billed in people's insurance companies the same way other consults are.
It makes sense if it's, improving people's lives, trying to help them as they go through a diagnosis. The dialysis example is perfect because that's something that is a long-term that you need to survive, but it definitely brings hardships on the patient and the caregivers.
That's actually correct. And many times people and their loved ones, their caregivers, are silently going through many emotions or thoughts or questions about what is the best next step. Do we want to continue the dialysis, and if so, for how long? Or do we think the dialysis is still being as helpful as it was when we first started it? Sometimes just having some of these conversations takes the burden off of the patient or family members, and they are able to speak openly and honestly about what they actually want, what their preferences are.
You've talked about a palliative care team. Who's on your team?
Generally, palliative care teams include a group of people. We call it an interdisciplinary team. So there are physicians, often some advanced practice providers like a nurse practitioner, physician assistant. We have social workers. There's usually some spiritual care providers as well, and a nurse.
Are you particularly adept at helping with pain management?
We are. We spend much of the time during our training focused on symptom management. So pain, but other non-pain symptoms are also things that we often see, such as nausea, constipation, shortness of breath, and we can provide some recommendations to people's primary care physicians or other specialists about how to manage some challenging situations with those symptoms.
How often do you get the family members involved? Is that an important part of what you do?
Absolutely. Our care team is not only our patient, but also their caregivers or family members. And so much of what we do during our discussions in the office or in the hospital are focus on symptom management, talk about goals of care, provide some support to caregivers, asking about how are you coping with everything going on and making sure that we know what the resources are that they need and try to align those with the available resources that we're aware of. And those are kind of the three big things that we do. And the last one I would say is advanced care planning, which is a gift not only to the patient so that his or her wishes and preferences are known, but also really to the caregivers and families because they feel like they can honor their loved one's wishes and not feel the guilt of making those decisions unilaterally.
Do you also help patients and their families decide between different treatment options?
We often will be asked to see people to talk about what's the next best step. And many times patients and the family members will come and say, this is what has been offered to us. What do you think about that? And it's more of a discussion about what are your goals, what are your priorities, what are you hoping for? And oftentimes that helps the person and families with what the best decision is with regard to treatments. And so while we don't often lead people to either treatment A or treatment B, we facilitate a conversation about what may be best for them given their situation.
Well, you've done a good job of explaining that quality of life is the main goal of what palliative care is all about. When patients and or their caregivers are thinking this is maybe something that we should look into a little bit more, what would you suggest that they do?
So Mayo Clinic has a website for our palliative care group, and they can look on there and read a little bit. There's also a video that highlights a couple of patients that have had good experiences with the palliative care group, and I think that'll provide a little insight into who we are, what we do, and perhaps how they could benefit.
Palliative care, it's a resource for anyone living with a serious illness. It can improve quality of life, it helps with managing pain, and it helps patients understand their choices for medical treatment. And if you opt for palliative care, you don't have to stop treatment for your underlying disease.
Palliative care, a great resource for anyone with a serious illness. Our thanks to palliative care specialist, Dr. Maisha Robinson from the Mayo Clinic in Florida. Thanks for being with us.
Thank you so much for having me.
Thanks, Dr. Robinson.